My younger brother dreamt of becoming a doctor when KSET used to be the entrance for MBBS in Karnataka. When he ended up with a larger rank and had to take up BDS, he made BDS his passion. Despite getting MDS orthodontics in his first attempt for PG, he took a year break and coaching to crack his dream course in dentistry, which was oral and maxillofacial surgery. Within a month of passing out from his PG, he was a consultant surgeon in over 15 clinics, earning dream income from the very first month. As I always tell my students, in any context, life leaves only two sensible choices. In case of careers, the two sensible choices you have are do what you love or love what you do. Let me ask you a question. Suppose tomorrow your NEET result comes and suppose MBBS does not happen. Does that mean your dream of working in healthcare is over? For many students, the answer is unfortunately yes. Because somewhere we have been taught that healthcare means only MBBS. Doctor means only MBBS. Success means only MBBS. But the reality is very different. If you could develop right passion, there are plenty of alternatives for you to serve as a medical professional. In fact, every hospital you visit today is filled with healthcare professionals who are not MBBS doctors. Think about it. When a patient enters a hospital, who takes X-ray? Who performs MRI? Who assists in the operation theatre? Who manages dialysis? Who handles respiratory support? Who helps patients recover through physiotherapy? Who supports critical care units? Healthcare is an ecosystem, not a single profession. And that is the biggest myth I want to break today. Let me navigate you through the hidden world of allied health sciences. Imagine a patient undergoing a heart procedure. The cardiologist is not working alone. There is an entire team supporting that patient, and one of the most important members of that team is the cardiac care technologist. Imagine a patient being wheeled into an operation theatre for a major surgery. The surgeon may perform the operation, but who ensures the patient remains safely unconscious? Who continuously monitors vital signs? Who works shoulder to shoulder with the anesthesiologist throughout the surgery? That's the professional role many students never hear about. The anesthesia technologist. Imagine a heart surgery where a patient's heart must temporarily stop beating. Does life stop? No. A machine temporarily takes over the work of heart and lungs, but that machine doesn't operate itself. There is a highly trained healthcare professional monitoring every second of that process. And that professional is called a perfusion technologist. Many students never heard this course name. Yet, during complex cardiac surgeries, lives literally depend on these professionals. Say a patient survives an accident, a child born with developmental challenges, a stroke patient loses the ability to perform everyday activities. Medical treatment may save life, but who helps that person return to living life independently? That is where occupational therapists step in. Their success is measured not based on test reports, but by helping someone return to school, work, family, and a normal life. During COVID, we suddenly heard words like oxygen support, ventilators, and respiratory care. Behind those systems were specialized healthcare professionals trained to support patients whose lungs could no longer do the job alone. The respiratory technology has become increasingly relevant nowadays. I'm really curious. Before this video, how many of the professions I described so far had you actually heard about? Let me know. Now you may ask, sir, professions sound fascinating, but where do we pursue them? The answer is very interesting. Through your KEA Counselling from many reputed colleges of Karnataka. In your KSET rank card, you must have received a rank of AHS, Allied Health Sciences. That rank fetches these seats in highly reputed institutions like Bengaluru Medical College and Research Institute, Mysore Medical College and Research Institute, Kidwai, MS Ramaya, etc. The 5 examples I took up are just small part of the list of courses that KEA is offering. You can find the link of 2026 seat matrix of AHS courses in the description of this video. By the way, many allied health sciences students study fundamental medical subjects such as anatomy, physiology, and biochemistry, similar to those studied by MBBS students before moving into their specialized domains. Now I want to address a very important aspect of these allied health science courses: the social stigma. Parents often compare careers only by social status, not by actual opportunities. There is a stigma in families that these professionals are assistants, not doctors. Let me burst that myth for you. Many people know the cardiac surgeon. Very few know the perfusion technologist. But during a open heart surgery, if the heart-lung machine is not managed correctly, the surgeon cannot proceed. Now tell me, is the perfusion technologist an assistant or a specialist? Many students and parents think these professions do not gain respect and recognition in society. Suppose someone from our family is admitted in ICU for 7 days. Who will spend more time monitoring him? The consultant doctor who visits twice a day, or the nurse who is continuously observing his condition? Respect should come from contribution, not from title. I personally have seen our gynecologist praising the radiologist for timely detection of a serious fetal abnormality and helped us take right measures at right time. As a family, we realized that day how important that specialist's role was. If you understood the social stigma is wrong, let me tell you how you should decide on this. You should ask yourself 3 questions. Question 1, do I want to directly work with patients? Question 2, do I enjoy biology enough to build a healthcare career? Question 3, do I want the title or do I want the profession? Because these two are 2 different things. Many students choose a title, but the happiest professionals usually chase a meaningful work. So, to conclude the video, if MBBS happens, wonderful, work hard and pursue it. If MBBS does not happen, please do not conclude that your healthcare journey has ended. The biggest myth after the NEET is that there is only one way to serve humanity through healthcare. There isn't. The hospital needs doctors, but it also needs dozens of other specialists whose expertise saving lives every single day. Your future should not be limited by a title, children. It should be guided by your passion, your strengths, and the impact you want to create. And sometimes, the career you never considered becomes the career you eventually love, as in case of my brother I explained in the beginning. However, if your dream remains MBBS and only MBBS even after this discussion, our next 2 videos are exactly for you. One would be, should you repeat NEET? The other one would be, should you pursue MBBS abroad? See you later. Thank you.